Welcome to Healing at the Speed of Light. Every week, we discuss how laser therapy is changing healthcare and how you can benefit. Now, here is your host and founder of Laser Therapy Institute, Dr. Jason Rountree.
All right, welcome back to Healing at the Speed of Light. I'm your host, Dr. Jason Rountree, and today we have a very special guest on the line. We have Dr. Scott Akridge joining us from Tri-Cities, Washington. And he is the absolute expert in laser in that part of the country. We're going to be spending a lot of time today talking about neuropathy in particular, and what it is, what that feels like, and how to get that addressed successfully with specifically laser therapy, but also what other types of treatments are done out there. It should be a really great episode. If you're suffering with neuropathy, this should be really great. A lot of things will ring true, I think, that you're going to hear concerning your condition, maybe treatments you've been through, and if you're considering or getting laser therapy for neuropathy, then this should be very, very beneficial towards building your knowledge of what's actually going on with your body, what you can do to help yourself, what you should be looking for when it comes to finding solutions for neuropathy. And then if you're in Dr. Akridge's area, he's the man to see. So Dr. Scott, welcome to the program. Thanks very much for joining us today.
Thanks, Dr. Jason. Thanks for having me on.
Yeah. So before we kind of dive into neuropathy in particular here, do you want to maybe just for a minute kind of tell us about yourself? And I mean, I know you're a chiropractor. I know you're excellent at laser therapy. You've been doing it for years now. But if you want to tell us a little bit about kind of your practice and how you developed your setup there, that'd be great to hear.
Yeah, it's fairly unique. We started doing laser therapy probably close to 20 years ago, back when we were using the lower powered lasers. And my particular niche in the neuropathy treatment was driven by my sister's passing away due to the complications of neuropathy that she had. And we kind of reached out to the chiropractic community to learn from others that were treating neuropathy, and we put together their recommendations along with our own knowledge and experience to come up with a program about 3 years ago to successfully help people suffering with this condition. We incorporated the class 4 laser for this treatment because of basically the speed at which we could treat the dose required for this condition.
Okay, wow. So this really has a very personal connection for you. It sounds like something you really have been passionate about for a long time.
Yeah, my father also had complications of neuropathy, and he didn't actually pass away because of it specifically, but it greatly affected our family, and we specifically reached out to learn how to help people with this condition to, have a greater quality of life, and in some cases actually being able to reverse the condition or the symptoms of the condition.
Wow, that's pretty amazing, especially when you consider, at least from what I've seen in my practice, when you have somebody come to you with neuropathy, with a neuropathy diagnosis, oftentimes that person's been told there's nothing they can do.
Yeah, definitely. They're pretty much, we reach out through the newspaper and other advertising to inform people about their condition, and it really resonates with them that what you just said, they've been told there's no help, and when they can actually learn that there's a place they can come to get education and treatment and give them the hope that they don't have to go down the road of where this condition ultimately leads.
That's great. That actually, what you just said there really resonates with me too. The whole reason we have this podcast going now, and the whole reason that I do a lot of the things that I do in our local community here in Montana, is to drive education and knowledge.
Absolutely.
I'm sure both of us then are probably seeing a lot of people who don't really even know what neuropathy is, what process is happening there. So this is a good point as any to start kind of describing a little better what we're talking about when we say neuropathy. So the neuropathy, when we start talking about that particular term, we really mean peripheral neuropathy, burning, pain, tingling in the feet, in the toes, and the hands.
Yeah, the numbness,
Mm-hmm.
just all kinds. My father, clear back in 1980 when I graduated, we didn't even really know what peripheral neuropathy was, but my dad was a chiropractor, I should say, and he says, my feet feel like I got bread bags on them. I can't tell if I step on a tack or whether I step on a marble. I just know it's not right. And is like, well, I don't really know what's going on other than you got some abnormal feeling. And that's actually what I see in patients that come in. They're totally kind of lost as to why am I feeling these weird tingling. Some people say their feet like they're walking on marshmallows, spongy. Some people say they can't feel anything at all as far as their feet are feeling. And a lot of them, I've come to learn that, it's not always associated with most people think of as diabetic neuropathy.
Right. There's actually different causes. Diabetes can cause neuropathy, and people think, oh, well, that's nerve damage from that diabetic process, and must be painful. But what else have you seen with that?
Well, one common one is our cancer patients that have undergone chemo, and they typically have more of the hand and arm numbness. They can have the feet, but the one that was the most surprising to me is the amount of people that were from the farming community. These guys that had been handling chemicals, pesticides, herbicides, solvents, diesel, sitting on the tractor and working and repairing these tractors and getting the chemicals on their body that absorb into the tissue that in long term cause this nerve damage. And
Wow.
the other one unique to us around here is we're in the Hanford nuclear project area, and a lot of these people that have been involved with being around the radiation and handling other chemicals out there years ago, we see a lot of that in this area. Yep, a lot of them.
Whenever I talk to patients about neuropathy, most people seem to understand the link to diabetes, but you're exactly right. There's toxicity related, medication driven, even neuropathies, chemotherapy related. There's a lot of different causes for neuropathy. So just because somebody's not a diabetic doesn't mean they can't have neuropathy.
Well, I'm of the opinion that actually, even prior to being diagnosed with diabetes, that the neuropathy can almost be like I explain it like the canary in the coal mine. These people, their blood sugars aren't in complete dysregulation yet, where they need the medical intervention that we call diabetes, but they're all in this metabolic syndrome of at least 20, 30 pounds overweight, the thickness around the middle, the syndrome X that they talk about. But they come in and they tell me, I'm not diabetic. And I just look at them and I want to say, yet. But you're getting, these symptoms you're getting are predictors of what's going to happen down the road. And I think that's one of the kind of the strengths of what I've incorporated into the neuropathy program in my office is I don't even mess around with patients that aren't going to change their diet and their lifestyle and the things that we know are contributing to this impending diabetic condition.
Well, I mean, that makes a lot of sense too, because, you know, no matter what treatment you do and how successful it might be, if the person's still every day agitating, exacerbating, injuring those nerves, their success rate's going to be really poor.
Yeah. I mean, the high consumption of sugar in our diet and the overconsumption of carbohydrate leads to this inflammation that, you know, ultimately causes the damage to the nerves and leads to what we call neuropathy. And, you know, I literally don't accept patients that don't want to make those changes.
Wow.
Because in my experience, we can shine the magic light on you and you might get some symptomatic relief, but ultimately we're not going to get that lasting change if the patient doesn't want to change. And it starts with, in my mind at least, diet intervention.
No, I 100% can see that. That's huge. You know, it's just like if somebody's on a medication that's creating neuropathy, which we know dapsone and a number of other medications, methotrexate, chemotherapy can cause nerve damage. We know if they keep taking that medication, if they keep going through that process, it doesn't matter what we do, they're not going to get better. But I thought it was interesting. You just said, you know, they might get a little temporary relief. But you're talking about not just temporary relief here. When you're treating someone, your successful treatment of neuropathy, you're talking about long-term changes, long-term improvements.
Oh, long-term, yeah. We've had patients that we treated 2.5 years ago that still come in to get the nutraceuticals that we recommend. That, you know, their neuropathy is gone.
That's incredible.
They don't have the numbness and the burning and the loss of balance that they had when they started.
Is that a little bit crazy? I mean, is that a little bit hard for some people to believe?
Well, if you haven't done it and if you haven't experienced it, yeah, it is. I wouldn't, you know, we're still learning with almost every patient of what we need to do in everybody's unique condition to, you know, get them to that point where their condition is, their body's healed.
That's amazing. Because I think most doctors, if you talk to them about this, they think that it just sounds impossible. And I know, and if I can plug one of our other episodes here on this podcast, when we talk about chemotherapy-induced peripheral neuropathy, we are talking about actually correcting the problem, correcting the symptoms so that these people have long-lasting, really what we'd consider permanent relief, which is just amazing. And here's another thing that I've noticed, and Doc, you're an expert in neuropathy. I've worked really hard to learn more myself, but I didn't learn really anything about neuropathy in school. And one of my new chiropractor we have here, she just got out of school about a year ago. She learned almost nothing about neuropathy. It was really just, hey, neuropathy is nerve damage, and that was it. And then moving on. And I see that it seems like across the board, even with some of the neurologists, the nerve specialists, there's not really that really in-depth knowledge about neuropathy. And what I believe that stems from is not because no one cares. Obviously, your neurologist cares, your doctors care about their patients. But if there's not a good solution out there for neuropathy, why even bother?
Well, their answer to neuropathy is to try to help with pain management, if that's part of the spectrum. But beyond that, how are you going to treat numbness, tingling, burning, these types of symptoms with a drug? I
Well, yeah,
mean, other than what do you call it, ablating the nerve so that
right.
there's no communication to the brain,
Yeah,
that's about their only answer. It's a wait until it gets bad enough,
yeah.
and then we'll give you some other drug to help control the pain.
Which we know from what we've seen here with neuropathy, and you'd probably agree too, I would guess, that the sooner you can actually get to those symptoms, as soon as they even are getting started and start treating, the more successful you're going to be, rather than waiting until they get really bad and then trying to do something about it.
Oh, certainly. And that's with, across the board. We have to, I think, as a society, we have to wake up and realize that, probably 90% of what we label as diseases in this country, cardiovascular and diabetes and kidney problems, dementia, they're all driven by a common denominator, and that's what we've been putting on our fork.
Mm-hmm.
And we've been sold that sugar and carbohydrate are great things to consume in mass quantities.
Yeah.
And that's what we've been doing.
Yeah, you're
And
exactly right. We're pretty good
yeah,
at that as a country.
well, the obesity rates speak for themselves.
Yeah.
And sadly, that's what comes with being overweight, is a lot of the heart problems and the diabetes problems, and it's just the cascade.
Something I've seen with folks that do have neuropathy, and I'll just say with especially chemotherapy-induced neuropathy, maybe folks aren't overweight, maybe they've been doing things, pretty well, but they get neuropathy, maybe it's in the feet, and then they become less mobile. They get to where they can't do things, they can't exercise because it just really drives them nuts in some cases. And so then they start adding on weight, and that really just compounds from there. So not only are they dealing with, the direct symptoms of neuropathy, but now they're dealing with lifestyle
Sure.
changes as well.
Yeah. Yeah. And that's another huge component of our protocol is working with therapies to help with balance, help with core muscle strength, help with, getting these people so that they can get back into being able to play with the grandkids and be able to do their golfing activities. Because that's another aspect that I investigate with these patients is, what is it that motivates you to come in here and learn what we have to help you, that's going to make you follow through with treatment, not only in the office but at home.
Mm-hmm.
I always call it, what's your why? And you got to have a big why to make these changes.
Agreed. And I think if we stay so symptom focused, then we end up more trending towards the medications. Gabapentin is very commonly prescribed, Lyrica, and the opioid medications, of course, too, because we're very focused on symptom control and not necessarily function control, where really what we need to be worried about is getting these folks back to where they can function normally, which does involve symptoms, but if we change the focus, then we can move more away from medication management of pain and get more into actually getting these people, like you said, better balance, core retraining. I mean, if you think about it, if you've not been able to walk normally for some of these folks years,
Mm-hmm.
and then you start getting feeling back in the feet, and the ability to balance, that has to be retrained.
Mm-hmm. Yeah, and you have to stimulate those pathways to the brain to actually relearn. And with the knowledge now of neuroplasticity and how the body can rebuild these pathways, that if we don't activate them, they're not going to regrow. And so we use some vibrational therapies to help with the balance and the core muscle strength.
Perfect. Yeah. We do that here as well in our clinic. We've got a balance retraining program to make sure that people can get back to that functional side. A big part of what we do, and you guys too, of course, is laser. So let's talk about laser. What we mean by laser therapy, of course, is not the cutting, burning surgical lasers, but we're talking about the very advanced therapy lasers that are completely non-invasive, yet do operate at a high intensity level and allow us to get a very large dose of light into the tissues, which research has shown that it does take a pretty large dose to work with neuropathy symptoms and get those to go down. So, Doc, when you have a new patient that comes in with neuropathy, what's some of the plan that you often will talk to the patient about as far as what kind of treatment and especially what kind of laser therapy you want to do with them?
Well, we've incorporated what was the K-laser, class 4 laser, now Sumas Medical, and we talked to them about using this light therapy in conjunction with the diet changes, the exercise, the nutrition. All these things combined are what we call our neuropathy protocol. Now, if you're looking at, we're looking at about 8 weeks of treatment initially, typically 3 times a week, of around 15 minutes of light therapy, 7.5 on each leg, thereabouts. And we discuss what they can expect as far as reduction of pain. A lot of times, if we're dealing with a lot of edema in the legs, we're monitoring that edema going down, the swelling. We're looking for a lot of times tissue changes in these patients, because some of them their legs almost look like leather.
Wow.
Because of the length of time of the edema. And so we've seen these people's legs literally go back to normal. I mean, it really is unbelievable until you see it in an experience with a patient that wouldn't think about showing, particularly the ladies, wouldn't think about showing their ugly legs, and to be able to have that skin come back supple and pink and alive, that's life changing.
Absolutely.
For these folks.
And something that most of the time they never expect to improve.
No.
And
they've been told that it's not going to.
Right, exactly. And so they expect, no, this is just the way it is now, and it might just get worse from here. Yeah. And it sounds, I mean, if you've not done this, it sounds like we're making stuff up, but absolutely. You see it in your clinic every day. I see it as well. Our LTI clinics get results like this all the time. And so, if you've got somebody who's got neuropathy and they're looking to start care, oftentimes they've already been through failed medications, things like that. Do you have anything to say to those folks who are considering laser as a potential course of care?
I think it's the number one option that you have, because the drugs are a dead end, and there really isn't any other option. And letting it run its course is not a happy ending. It's affected my family in a terrible way because we didn't know how to deal with it at the time, and it's coming in. I spent time with you here a year and a half ago, and you educated me tremendously on what we could do to help. And I just took a few other things that I've learned along the way and trial and error with things that, seemed to help, and then we got rid of the things that didn't help, and to this day I'm still looking for options for patients, and even I would have to say that, patients come in and educate me on how to help them by having, a particular condition, and I'll dive into whatever it takes to help figure it out for them. So
I got to say, that's always refreshing too, that this isn't just some cookie cutter program that you developed, that it's an individualized approach, which I think is just critical for neuropathy.
It is. I had a new one yesterday that probably off the air I want to talk to you about and pick your brain for, because it's one of those 2% diabetic conditions that, in my 40 years I haven't run into. So we'll need to talk just a little bit. Like I always send you my crazy little emails.
Well, I'll tell you what, that's been one of the great things with LTI being a membership of laser experts, that we get to learn from each other, and really work together on cases that otherwise you might find really hard to learn how to manage, and might take long to get that patient better. But we can learn from each other what we've seen work, what we've seen not work. Matter of fact, LTI, we just pushed out, I believe, 3 new laser programs for neuropathy. So you and I will definitely have to chat about those too, if you haven't gotten into those yet. Yeah, they're pretty exciting. So when we chat, we'll go through those. But I think that's one of the greatest things. We're seeing just leaps and bounds in terms of how fast people can get better, and people that formerly had no options actually have options to get better now. And I think it's just really exciting. And I'm very, very, very happy to have you as one of our stellar expert members. We are about out of time. So I got to say, I very much appreciate you joining us today. It's always a pleasure to speak with you. Really impressed with what you're working on there. And if you're in that Tri-Cities, Washington area, and you're dealing with neuropathy in particular, but any additional medical conditions that could benefit from laser, I highly encourage you to look up Dr. Scott Akridge. Doc, you want to give us your phone number and maybe your website?
It's area code 509-783-8145, and it's AkridgeChiroClinic.com. We can be reached at either one.
Perfect. Excellent. So, well, I again greatly appreciate your time today, and we'll be chatting again soon, I'm sure. All right. Thanks so much.
Okay.
Subscribe to this weekly podcast for more great information. Find a certified laser therapy clinic near you at lasertherapyinstitute.org. If you are a healthcare provider, check out our practitioner-focused Laser Therapy Institute podcast. Thanks for listening.